shift to the Dr. Ashraf, Professor Ashraf Mansour from UCA, bleeding complication of PAVSS.
Thank you very much. I appreciate the invitation to discuss this topic with you. As vascular surgeons,
usually we do at least 6 weeks of antibiotics after that. Thank you for the attention. Again, thank you for the invitation, and I wish I could be there with you all. Great meeting.
I don't have anything to disclose. I appreciate the invitation to be back in Egypt and in beautiful Luxor. So as vascular surgeons, we're always balancing an act between anticoagulation and hemostasis. And the question came up as to the use of Plavix and aspirin or dual antiplatelet therapy in our patients, especially the patients who undergo carotid interventions and carotid stenting, are at a risk of developing some bleeding issues. So as this slide shows you, the bleeding complications with carotid surgeries is somewhere between 3 and 8%. And the patients who have a reoperation of their neck are at a higher risk of mortality, complications with cranial nerve injuries. They require blood transfusions, and the length of stay is increased. And when you look at the predictors of increased length of stay after carotid surgery, the third reason is bleeding hematoma after surgery. And as you would expect, this predicts a bad outcome after carotid interventions. And the patients who are at highest risk are those who have multi-level and multi-disease, such as PAD and COPD on top of their carotid disease. So we wanted to explore the incidence of bleeding after carotid endarterectomy. And some of you in the audience probably remember the old days when we used to put PTFE patches on the carotid, where you'd finish the operation and spend just as much time trying to stop the bleeding from the holes. This paper came from England from Dr. Ross Naylor, and he looked at 440 patients and found that the bleeding incidence was 6%, and that the contribution to bleeding was mostly from postoperative hypertension. And all these patients had a longer hospital stay. And then the question came, should you use protamine after you give heparin for carotid endarterectomy? And there were some people who felt like protamine administration increased the risk of stroke after carotid endarterectomy. But it turns out that this is not the case. And in fact, a large group, the New England Surgical Group, looked at almost 4,500, or just over 4,500 patients that had carotids. And they found that the bleeding incidence is less if you give protamine, reverse protamine, after you give the heparin at the end of the operation. And at the reoperative risk here, as you can see, MI is 4 times higher, stroke is 7 times higher, and death is 30 times higher when patients develop bleeding complications. So the use of protamine for anticoagulation after carotid in the meta-analysis, these are all the studies that looked at this. And they found that actually protamine is quite safe to use and is recommended to decrease your risk of bleeding. And you can see here that's from this meta-analysis that favors protamine administration. So there's no question that from multiple studies that this is should be standard. So if you look at our patients that develop neck bleeding after what are the factors? Hypertension obviously is an important one, and the question of whether you do dual antiplatelet therapy with aspirin Plavix or aspirin and Tyclid, if that makes a difference or not. And we all like to use Plavix as it's been shown to decrease the risk of stroke with carotid endarterectomy, and that, but all-cause mortalities and asymptomatic disease is certainly a factor when we prescribe this medication. And in this European Journal of Vascular Surgery study, you can see here that reoperation is not an easy thing as you increase the risk of cranial nerve injury with this. So what we did was we reviewed almost 1,500 cases in our hospital who underwent carotid surgery and found that our incidence of bleeding that required return to the operating room was 1.9%. And as you can see here, that most of the patients were on aspirin statin, and just over a third were on Plavix. What we found interestingly was that time to reoperation was approximately a mean of 7.7 hours, and the range was 1 to 81 hours. The length of stay was increased because of the bleeding, and the 30-day mortality was increased as well. Then we looked at the relative risk of developing hematoma requiring a take-back. It was not significant. So we decided to expand our study and look at all patients in the state of Michigan who are undergoing vascular surgery, over 10,000 patients in a statewide registry. And that included both academic and private hospitals, and this represents real-world work. And we found that approximately a third of the patients were on Plavix, and 2/3 are on aspirin only. And then again, we found that the p-value was not significant in terms of cause and effect of bleeding. So I'd like to summarize here by saying that the risk of bleeding does not appear to be worse when you use Plavix, especially for carotid interventions. The patients on Plavix are often sicker and have multiple risk factors which might be contributing to the issue of postoperative bleeding. But the recommended guidelines are to use protamine at the end of carotid surgery to try to decrease the bleeding from neck surgery. Thank you very much for your attention.